2005 and IHR amendments. This special session is going to address amendments related to points of entry and border health, but we'll also have a session on the longer-awaited information on domestication of the 2024 amendments of IHR 2005. I would like to welcome all our participants from within Africa and beyond. We are all happy to have you here with us. To start off with the session, I'd like to ask Ms. Pearl to take us through the housekeeping rules so that we are all together in how we are going to run this webinar. Over to you, Pearl.
Thank you very much, Dr. Miriam. I'll start with the housekeeping remarks. There is interpretation available in English, Portuguese, and French. Please click on the interpretation globe icon in your Zoom toolbar to select your preferred language. If you have any questions related to the presentations, please use the Q&A feature and not the chat feature. For general comments, introductions, or IT-related issues, please use the chat function. And if you'd like to take the floor, please kindly use the raise hand feature, and our moderator, Dr. Miriam, will call upon you. On some of the devices, depending on whether you have updated Zoom or not, the raise hand feature may be located under the react button, which is the heart-shaped icon. So just to practice now, can you practice raising your hand from your computers? I just want to see whether... Sorry, react with a thumbs button if you can raise your hand. Yes, thank you.
Okay.
Thank you. Okay, next slide, yes. Please note that this webinar is being recorded. By participating, you're giving consent for your contributions to be captured and shared for learning purposes. Additionally, all session materials, including the recording, will be shared with participants in the days following the webinar. Next slide, please. Please be assured that your individual data will remain confidential. Any aggregated data may be used to support reporting, generate maps and communication products, and inform any future new initiatives. So the objectives of this fourth session of our IHR clinics are firstly to brief national authorities, including IHR, national focal points, and WHO country offices on the 2024 IHR amendments related to points of entry, border health, and public health measures. The webinar will also provide guidance on the domestication of the 2024 amendments of IHR 2005 with national legal policy and operational frameworks. So here is today's agenda. The webinar will cover brief welcoming remarks. We'll begin with brief welcoming remarks from WHO AFRO and WHO EMRO. We have two main presentations, which I've mentioned and Dr. Miriam has mentioned before. The first will be on IHR amendments at points of entry, border health, and related issues. This will be followed by the second presentation on domestication of the 2024 amendments of IHR 2005. Each presentation will be followed by a Q&A session, and then we will conclude with a summary of next steps and closing remarks. Over to you, Dr. Miriam, to introduce the panelists. Thank you.
Okay, thank you very much. As we are now aware of how we are going to run our meeting, please remember to put up your hand, especially in our Q&A sessions, so that you get your answers. Get answers to your questions, but also use the Q&A platform so that your answers can be given to your questions. Today we have opening remarks, or just a few remarks from our program area manager, Dr. Chamla, and also from our senior colleague in AMRO, the team lead for IHR Assessment, Monitoring and Evaluation in WHO AMRO, Dr. Amgad Abdallah, and we will have the presentation on IHR amendments at points of entry and border health from two of our colleagues, Dr. Fatima Arija, who is the technical officer of WHO on points of entry, but also on mass gatherings in EMRO. And then from Dr. Abrahim Mamatu, who is the technical officer here in Nairobi on operational readiness and points of entry. They'll give this presentation together. And then we'll have a Q&A session, and this will be followed by the presentation on domestication of the IHR amendments. This will be given by Dr. William Onzivo. Dr. William Onzivo is a technical officer legal for WHO AFRO. His work involves guiding countries on how to domesticate the international laws and international treaties, and he has done this at the global level as well as the regional level where he is now. And he's well experienced but also well trained in this area. He's a lawyer by training, unlike many of us who are medical. And then he also has a PhD in international law, health, and environment. I think that we'll tap as much as possible from him on how we go about this domestication. And then I'll take you through the next steps. I hope that we will get enough from these technical experts for each one of you. So without further comments, I'll ask Dr. Chamla to give a few remarks, and this will be followed by Dr. Mugad. Over to you, Dr. Chamla. Dr. Chamla?
I think he's disconnected, eh?
Okay. Is Dr. Amgad on call? Dr. Amgad, over to you, please.
Okay, thanks so much, Dr. Mariam, and thanks all. Good morning, good afternoon, colleagues. It's my honor to welcome you to this important gathering on IHR amendment related to point of entry within the framework of IHR 2005. Point of entry, as you know, be they airport, seaport, or ground crossing, are the sentinel of our collective air security. They are where the world meets and where our vigilance should be the strongest. As you know, diseases don't need passport, don't respect border, and don't wait in line. In the world of increasing mobility, the strength of our point of entry system and the capacity is not just a matter of national security and national safety. It is a cornerstone for the global and regional health security. The IHR called on us to work together to ensure that our point of entry can prevent, detect, and respond to the health system while keeping point of people and goods moving smoothly. During today and during our session, we'll go through different points, different aspects of how IHR, either the original IHR version or after amendment, focus on the importance of a point of entry. Looking forward for fruitful discussion, sharing experience among all of us, and I'm sure by this kind of workshop, and I would like to take this opportunity to thank our colleague from AFRO and the hub for their kind support and facilitating and coordinating this meeting. Wishing all the best for all of you. Thank you.
Yeah, thank you so much, Dr. Amgad, for those very insightful words. Indeed, diseases don't respect borders. And we have the points of entry that are formal and we have those that are informal, and they are real sources of cross-border transmission, as we have seen in the past. So we'll be glad to hear from our colleagues as they start on the presentation regarding the amendments at the points of entry. We turn this to you now, Fatima and Mamadou.
Okay. Just a minute. I'm trying to share my screen now. Sure. Okay, screen one. Please confirm if you can see my screen and presentation. Okay, perfect. Thank you so much. For this great opportunity here, I will start this presentation to discuss about the amendments to the articles relevant to the points of entries, public health measures, and health documents. So today I will be presenting with my colleague, Dr. Ibrahim. So I will start and then my colleague will take over. So here just to, start with a little bit of background. I know you hear it a lot, but just to place the importance of points of entry here, which is fitting within the scope of international health regulation, which is to prevent and respond to the international spread of disease in a ways that is proportionate to the risk, but also importantly to avoid the interference and interruption with international traffic and trade. That's why points of entry here, it plays very important role because it's the passage for both international entry and exit of travelers, but also goods, parcels, as well as the agencies and areas which are providing services to them. So here you can see a snapshot of all those relevant articles, which talks about the points of entries, health documents, and public health measures. So we'll be sharing this presentation after the webinar. You can have a look. But in this presentation, we will only focus on the amendment articles, and you can review the other articles related to the points of entry later. So first, Article 18. So, yeah, can you still see my screen?
Yes, we can.
Okay, perfect. Sorry, I had some interruption with my own screen. So first, Article 18, which talks about the WHO recommendations in respect to persons, but also baggage, cargoes, containers, and conveyances. So here we have a new article, a new paragraph, paragraph 3 to the Article 18, which talks about the WHO recommendations. Because, during COVID-19 pandemic, we have seen a lot of interruptions with international travel and trade, but here the main aim is to avoid such interruption, but also to maintain and protect the health of healthcare workers, but also the care workers and vulnerable individuals, and to ensure that the amendments support the life-saving support. It's not obstructed by the restrictive travel measures. But also the next one is to maintain the international supply chain going. The main aim is to ensure that the recommendations are flexible and still the international supply chain is not interrupted, and the health products and food supplies they are still in flow, and there is no interruption in these essential services. And then on the Article 20, as you can see, here are some minor amendments. So there are some minor amendments related to Article 20. As you can see, one is the core is added to the term capacities, but also Part B of is added to Annex 1A. It's just more, there are these minor amendments, or more for consistency purposes. and also to specify that the core capacity requirements are the ones which are outlined in Annex 1B, and to specify that the 1X1B of the IHR, it outlines the core capacity requirements for the points of entries. And then Annex Article 24, which is about the state parties' obligation to ensure that the convenience operators they comply with the public health measures, which is recommended by WHO. So you can see here in subpara A of paragraph 1, there is a new responsibility of convenience operator. Convenience is such as ships, aircrafts, or ground transportation like buses, trucks. And convenience operator is mainly the legal entity or the agency who is responsible for them. So here it kind of expanding the responsibility of the convenience operator, that it's not only during the boarding, but also to ensure the whole phases of journey, that it includes their responsibilities on board and also during embarkation and disembarkation. As during COVID-19, some measures were during embarkation, for example, some vaccination cards were asked. For example, they were asked to wear a mask, and some other measures were requested. So here they want to emphasize that the convenience operator responsibility it covers all phases of voyage and during onboard embarkation and disembarkation as well. So yeah, and the same thing in paragraph B, same amendments are made. And then Article 27 is about the affected canyons. Article 27, it's about the actions that the competent authorities they can take on board of the canyons. So here, for the public health measures, just quarantine is added as well as the isolation. So it's added because it wants to make sure the competent authority they can promptly respond to to contain the spread of infectious disease. As you know, there is a slight difference between isolation and quarantine as defined in Article 1 of IHR. So quarantine is this restriction of activities or separation of those who might be suspected and who are not ill. So that's why they added the quarantine in addition to isolation as well. And then the next one is about Article 35. So Article 35, the general rule, it talks about the health documents which was required under IHR for the international traffic. So here, as you can see, it's kind of setting at the cornerstone for the digital documents as it was used prominently during COVID-19 pandemic, for example. Digital PCR certificates were asked, the vaccination card was requested. That's why there are new 3 paragraphs added. Mainly it talks about 3 things. First, the format of health documents, that it can be both in digital format and non-digital format. And then what are the features of health document? So they will conform with the annexes, such as Annex 3, 6, 8, 9. So we'll talk later what are those annexes and what it encompasses. And then to conform with Article 45 regarding the personal treatment of the personal data. So just an addition that there is I think our colleagues in headquarters, they can add as well, but there is ongoing, so there is a technical working group who will be working on technical guidance, how these digital documents will look like, and also a member states consultation will take place in the coming months to clarify the use of the digital and non-digital documents related to international travel. And then the next amendment is that the name of Maritime Declaration of Health is changed to Ship Declaration of Health in all relevant articles, but also in the annexes, such as Article 37 as well as Annex 8. So everywhere the Maritime Declaration of Health is modified to Ship Declaration of Health. It was mainly due to suggestion that the member states were saying that the maritime, the term is broad and it's covering anything related to the sea or navigation, but she is according to IHR, it is defined as any seagoing or inland vessel that it takes international voyage. So they wanted to make sure that the certificate applies to the vessel itself. That's why they suggested this amendment to change the Maritime Declaration of Health to Ship Declaration of Health. But again, there is WHO will be circulating a state party circular on this one, which is calling for the flexibility on the use of this name, as long as this certificate is compliant with the technical and layout requirement as it's outlined in this regulation. So, so WHO calls for flexibility on the use of these names. And then we have Article 43 on the additional health measures. There are some new amendments which says that if some state parties they're implementing the health measures and the other countries are impacted, so WHO can facilitate the consultation between those member states to ensure that they are based on scientific evidence and public health rationale, and that if requested by member states, those consultations will remain confidential to balance the exercise between the state party sovereignty as well as the DG's proactive role in settling such disputes. And then we have the annexes. So first, Annex 1A, which has the majority of amendments has happened in this annex. First, as you can see, the title is changed. Before it was starting with Annex 1A, but here it's Annex 1. The name is changed to core capacities, and the first 4 paragraphs, it mainly is general to ensure that it accurately reflects the contents and the structure of this annex. And then the term prevention and preparedness is added to ensure that it's in line with Article 2 with the purpose and scope of IHR, but also with the SPAR and the JE to see all those areas of core capacities are included. And then reference to Article 19 is added to paragraph 2 to ensure the general obligations related to the points of entries. And importantly, you can see new paragraph 4 is added on the collaboration, as there was a specific session, I think, covered by our colleague last week on the international collaborations. Again, here, it's emphasizing more that developing these core capacities under IHR, it's a member state's shared responsibility to ensure these capacities are in place and they can collaborate on developing, maintaining, and strengthening those capacities. And then the Annex 1A starts. So here Annex 1A, previously it was core capacity requirements for surveillance and response, but now the new name is that it includes, as I mentioned, prevention and preparedness as well. So it is the core capacity requirement for prevention, surveillance, preparedness, and response. So here it outlines the capacities at all levels, starting from local level, intermediate level, and national level. Kind of is setting the benchmark of minimum capacities that needs to be in place at different level. First, at the shape of the paragraph, as you can see that we have that at the local level, each state party should develop, strengthen, and maintain core capacities. As you might remember that the report of the IHR Review Committee on Extension of Core Capacities under IHR in 2025, it mentioned that the state parties' efforts to develop IHR capacity is a continuous process. Once you develop those capacities, it's important to ensure that those capacities are further strengthened and they are maintained, and they are not only developed in response to emergencies, but to continuously enhance and build on those capacities under IHR. So that's why you can see this addition in chapter of this Annex 1A at different levels. And then the capacities at local level, it's added more because it during COVID-19, again, we have that example that we need to contain the outbreak as its source, and only national capacity is not enough to respond to infectious disease outbreaks. So that's why we need to also strengthen the capacities at the local levels. As you can see here, the implementation of public health preliminary control measure is added in SAPRA C, but also new to SAPRA is added to prepare and facilitate access to health services, to respond to public health risks, to ensure that the health service is a critical component of the response, but also importantly to engage stakeholders and community at the local level as well during the response. And then we have another Annex 1A, the capacities that needs to be in place at the intermediate level. Again, at the SHAPO, we have the adhesion to strengthen, maintain, and develop these capacities I explained previously, but also further capacities is outlined to be developed at the intermediate level. Here, a notice added where applicable. It's because some, based on the jurisdiction and administrative definition of each state party, the definition of intermediate level might be different. They might not have intermediate level. So again, the footnote is it kind of clarifies more that it should be defined based on the jurisdiction of the member states, whether some components of these capacities can be developed at the local level or at the national level. So some other capacities which needs the coordination between local level and intermediate level is added at the intermediate level, such as surveillance, on-site investigation, laboratory diagnostic, and other capacities, as you can see. And then we have the capacities at the national level. So here, based on our lessons learned that we had during COVID-19 pandemic, so this annex is further clarified to include all those capacities and also others which were missing, to ensure that they are more clarified and consistent across overall provisions. And based on the importance of some new core capacities are added, such as surveillance, case management, IPT, RCCE, and also importantly to address misinformation and disinformation during the public health emergencies. And you can see here we have a new paragraph on the important role of the national level, which plays as coordinating body between the different levels and different sectors. That's why this amendment is also made. So for the remaining of the presentation, I will give floor to my colleague, Ibrahim. Ibrahim, over to you, please, to take us to the next slides.
Thank you, Fatima. And just to reemphasize to colleagues, in the 1A, that means now IHR is looking not just at the national level, but going down into the intermediate and the local level capacities and describing them in more detail. So in Annex 1B, which if you recall, is the core capacity requirements for designated POEs, it has two broad sections. One is the capacities at POEs for all times, what we call in the subsector routine capacities. This includes assessment and medical care of conveyances. As Fatima said, this includes aircraft, ships, trucks, trains, and other transport means. It includes the equipment and personnel for the transportation of travelers or samples. It also includes ensuring safe environment, water, food, waste, washrooms, shower areas, all the other wash areas within the POEs and potential risk areas as well. So that encompasses inspection programs for all of the above. It also includes the trained staff and personnel and a formalized program for vector control, recalling that there is an area of responsibility of the competent authority around the perimeter of the POE. Next slide, Fatima. It also includes the other big section, which is responding to a potential fake. You remember that in the past sessions, you were told the definitions of a fake as well as the new term, the pandemic emergency. So this includes especially having a public health emergency contingency plan, specifically for the POE, which should be multi-hazard, having a coordinator, contact points for the POE, as well as other POEs, other sectors and other agencies. Also, assessment and care of travelers in the spirit of One Health, including animal referrals, veterinary facilities for isolation and treatment and other services. Provision of space separate from other travelers for interview of suspected or affected persons. D is provision of assessment, quarantine of suspect or affected travelers, as Fatima mentioned earlier. Also to apply recommended measures, which includes but not limited to disinfection, deratting, decontamination of baggages, conveyances, and other aspects. Also around screening to apply entry and exit control for departing and arriving passengers. And finally, provide access to equipment and protective gear for personnel and travelers, including PPEs. Not just for biologicals, but also for non-biological, including chemical and radiological. So I'll quickly go into some of the updates to Annex 1B. Very simple changes. In Section 1, each state party shall develop, strengthen, and maintain has been added, just to emphasize and underscore the state party's responsibilities and obligations. In Section 2, for responding to events that may constitute fake, each state party also shall develop, strengthen, and maintain the core capacities. You recall, as Fatima said, it's not just to attain these capacities, but it's also continuously maintaining and strengthening these capacities. So Section 2A and B, an addition has been made from the old IHR, where concerning affected travelers and animals, arrangements with local medical, including veterinary facilities, and very importantly, learned from COVID, laboratories for isolation and treatment and analysis of their samples. You remember the examples of COVID where samples would need to be taken at POEs and then sent to a reference laboratory for testing. So this is encompassed here. The arrangement with local facilities or laboratories. Next slide, Fatima. So the updates to Annex 4, technical requirements pertaining to conveyances and conveyance operators, as was described in Fatima's presentation. Conveyance operators, what has been added is now prepare for as appropriate and facilitate inspection of cargoes, containers, and conveyances, medical examinations, and as well as application of health measures, as well as the update to the ship declaration of health. So the purpose of this is to strengthen the aspect of preparing for, with the emphasis on readiness and anticipatory actions rather than just reaction to a public health emergency. Also the emphasis on whole of journey travel, which means not just while passengers are on board, but the process of embarkation and disembarkation. You can see from the picture, the process of screening before passengers are allowed onto conveyance and exiting the conveyance, as well as the whole of the travel journey. Next slide, Fatima. Now, Annex 6, as Fatima has mentioned earlier, is established through Article 36, now has come in to include clarifications on not just our non-digital, which is the paper-based certificates, that's around vaccination, prophylaxis, and related certificates. We recall during COVID that there was a lot of digital-based certificates. So Annex 6 has been updated to capture, as you can see in the picture, provisions around digital vaccination certificates, as well as re-emphasizing the features of the non-digital, which are our paper-based certificates, like our yellow fever vaccination certificate. The need has been emphasized on the signature of the parents as a substitute for the minor in the non-digital based. Next slide, Fatima. You recall during COVID, many a times we needed to upload digital and QR code based forms rather than what we are used to as paper-based vaccination forms. So IHR has been updated to cover that. Next slide. I think there's a bit of a lag, but I'll keep talking. Also, on Annex 7, this is just to reemphasize the previous amendment around proof of vaccination, which may be required for travelers as a condition for entry to several state parties. So what we are usually used to, if we recall, is the yellow card from yellow fever. You recall in the previous sessions, it was updated that the yellow fever vaccination validity period for the certificate now extends from beginning 10 days for life, rather than what we are used to that previously, that was 10 years vaccination period. So this was amended in a previous World Health Assembly 67 in 2014. Next slide. So tying this together, just to remind us of what we've learned in previous sessions around how these apply to our IHR monitoring and evaluation framework. You recall the components, state party annual reporting, and the other components. Please go to the next slide. In your ESPA annual mandatory reporting, you recall that C11.1 describes the capacities, what that we call the routine capacities. I've already spoken on that at all times. The next slide. SPA indicator 2 speaks to C11.2, your capacities to respond to a potential fake, which is public health response at the points of entry. As you see, as you go higher in the grading, you will find that it goes from planning all the way up to ability of your multi-hazard POE-specific plans to be tested and exercised regularly, which is tying into what Fatima mentioned around the continuous maintenance of capacities. And this ties into components of the IHR MEF, which are the simulation exercises and other exercises, as well as the reviews, after action review, interaction review, and now early action review. The next indicator in your ESPA is not an amendment, but it is a change in the SPA indicators, giving a new indicator from a recommendation of the IHR Technical Working Group review in 2021, requiring countries to adopt a risk-based approach to international travel-related measures. Now, this means countries should measure that they have scientific and risk-based approach to implementing these measures that, for example, Fatima described earlier around school closures and other measures, or measures in the points of entry. And these need to be multi-sectoral, taking into account even the industry players that are affected by these measures. Takes into account a risk-based approach. It needs to have the same levels as was described, national, intermediate, and local, include written guidelines and SOPs for how they will be implemented, as well as need to be exercised, reviewed, and evaluated regularly. So an example of this, many member states, you recall, during COVID, tried to incorporate PCR labs into POEs without taking a risk-based scientific approach as to and multi-sectoral as to what the effect would be. But you do know that most of our POEs, no matter how developed they are, were not designed to have laboratory measures, and these created new IPC and other complications at the POE, which led to many member states abandoning those kind of interventions. So this indicator requires that additional measures are done based on the best science and best risk-based analysis. Next slide, please. This is just a reminder of the ESPA submission. Next slide. Next slide. Fatima. And just to cap it up as we round up on this session, this is AFRO analysis from an excellent paper that was published by Dr. Talisuna and many members of this team, analyzing all our JEE scores within the region. And we can see that POE has quite a lack of capacity. Very few countries were at sustainable level. So there's a concerted need, and hopefully in the next round of JEE, we'll see that there are more countries with developed capacities in points of entry. As I move to the next slide, I would just like to emphasize that in our points of entry and border health, there are a myriad of guidance documents to describe all of what we have been speaking about. There's several handbooks, including around designation, assessments, and management of events at different types of points of entry, including guidance on what criteria you can use for designation. So I'll end in conclusion by saying to strengthen POEs is essential because we are all not safe until all of us are safe, and we're only as strong as our weakest link. I stop here and yield back to the moderator.
Okay, thank you very much. Yeah, thank you very much, Mamadou and Fatima, for that presentation about the different amendments that are happening, that have been approved under POE. Small changes, but which are important in the different articles as well as amendments. So we are now going to have a session of Q&A. Please feel free to put up your hand if you have a question, and then they will open for you. They'll open and you'll start talking. We are waiting for you to put out your hand. In the meantime, there are some questions that have been asked and answered. Maybe Hamid, you can help to really answer the questions that you have already answered. Please, you talk about them so that everyone can understand that first question that you have answered.
Yeah, thank you so much, Mariam. So for the first question on the monitoring of the capacities mentioned in Annex A, so that is the Annex A and all other IHR required capacities are evaluated through the IHR monitoring and evaluation framework, including the state party annual report as well as the joint external evaluation, which are conducted periodically. The annual report from its name is annually, while the JE, which is a peer-to-peer review, is conducted from 3 to 5 years.
Mm.
Yes. So another question on the National IHR Authority, which has been already discussed last session, so they can refer to the presentation and the recording. Dr. Fatma already responded. Yes, there is a guidelines, and she shared a guideline for designation process for the point of entry, and she already shared the link.
Okay. Thank you
Thank
very
you.
much. Yeah, Fatima, do you want to answer some of the questions? Colleagues, you are free to put up your hand as we answer the questions in the Q&A platform. Please feel free to put up your hand. Then they'll open for you the microphone so that you can we can receive your question. Over to you, Fatima. There are some questions that are in the Q&A platform. Please go ahead.
Thank you so much, Mariam. I think most of the questions are answered, just related to the guideline for the designation of points of entries. Yes, there is a guideline. I think this was also developed recently based on the request from many member states and the points of entry competent authorities that they want to know what are the exact criteria for each types of points of entry. When to designate the airport, how to designate, the ports or ground crossing. So I have provided the link for that guidance. So there is one, please review. I think you will also receive the slides after this webinar. So please feel free to reach out to myself and Ibrahim if you have any questions. Thank you. I think the other questions are already responded by colleagues in the chat, but please let us know if you have any questions Over to you, please.
Okay, thank you.
So
Dr. Tiebley? Dr. Tiebley, are you
Yeah.
able to interpret this question by Constant?
By consent, okay, yes, I do have it. Constant say thanks. Is it the first question? She said thanks for the presentation. What's the frequency of the surveillance for the capacity to verify, and that's what she asked for. And for audit purpose, for example, Annex 1, but the answer was given by Dr. Ahmed already.
Yes.
Yeah, okay.
Okay. So
And
that is fine.
can I add one to Ahmed answer?
Yes,
And
please.
yeah, the colleague need to remember that for the IHR evaluation and monitoring and evaluation framework, the performance for veterinary services contribute to that one. And so they just, it's not excluded. It is an important part of it. Thank you.
Okay, thank you. Over to you, Hamid.
okay, thank you so much. Another question on the relation between the amendment and IHR to the building access facilities, hospital, train station, and different point of entry and health structures. So in fact, the IHR in principle does not describe any detailed architectural standard for any new building. But however, the principles of the IHR emphasize that each design, for example, and construction of public access facilities should uh, should respect the principles that strengthen the health, security, resilience. So, for example, adequate ventilation, infection prevention and control measure, accessibility for health screening, in particular for the point of entry, for example, and also the capacity of the building to support the emergency response operation. So, in WHO through the IHR, so we encourage that the lessons to integrate the lessons from COVID-19 into the national building codes, that for example, and as well as the infrastructure policies, so that need a collaboration between the health authorities, ministries of health, with the urban planner and other relevant ministries that feature the facilities and the structural the code, the structural code of health facility buildings. Over to you.
Okay, thank you so much. Who else? I see there's a question by Albertina. With this amendment under Annex 1B, does that mean that the IHR core capacity assessment tool will be reviewed to incorporate the few amendments, or the tool will remain as it is? I think, yes, please go ahead.
Yes, Miriam, I think our colleague from headquarters, Sarah, is on the call with us. Maybe she can provide more updates on that. Sarah, over to you, please.
Okay, please go ahead.
Yeah, hi, it's Roberta Andraghetti from HQ.
Yes,
The
please.
state party annual report tool will stay the same for reporting to the next health assembly in May 2026. And a revised version will be available for reporting to the assembly 2027. And this will be communicated to state parties, and they've already started looking at the adjustments that need to be made to the SPARS, the state party annual reporting tool, to incorporate the amendments. Over.
Okay, thank you, Roberta. Right. Then there's a question by Russ. The new requirements for POEs are comprehensive. What are the key financing and capacity building strategy that the WHO is implementing to support the low and middle income countries to meet these standards? Over to you, Mamadou.
Sorry,
Mamadou.
okay, I had a challenge on muting. Yes, so as the IHR capacities have changed, we are also looking at now, as was said in previous sessions, more amendments as towards the solidarity and equity. This includes also those amendments that spoke about the improvement and commitments towards financing. So these will automatically then apply also towards the border health and POE capacities within the IHR. But there are no specific ones that are targeted towards the amendments in border health. However, the general changes that were mentioned in previous sessions around improvement of financing, as well as WHO's solidarity towards supporting implementation, apply also to the border health capacities. I hope this answers the...
I think so. If there's need for more explanation, please feel free. Yeah, Dr. Hamid, any addition?
No, thank you so much. Was well said by Dr. Ibrahim.
Okay, please. And Fatima, there's a question by Florence, which is talking about the reviewed vaccinations, asking about yellow fever vaccine. Is it the first dose only what you get as a child, or you need an adult dose? I think you need to clarify about the yellow fever vaccination, then the hepatitis B and C, etc. But please clarify about this vaccination for yellow fever and other infectious diseases.
Thank you so much for that question. As you know, under the international health regulations, the only vaccination certificate which is required under IHR is yellow fever vaccination. So where the countries are identified that you're at risk of yellow fever, so the state authorities can require the certificate of yellow fever vaccination. So that's the only requirement under international health regulation. Previously, the duration was that we can update the yellow fever vaccination each 10 years, but now the immunity, as based on the last World Health Assembly decision, so now the duration of validity is lifetime. So now if you're vaccinated once for yellow fever, so you will gain immunity your lifetime. So this is for yellow fever. For hepatitis B and C, it's based on your national requirements and rules. It's not hepatitis B and C, it's not mandatory under international health regulations. Thank you.
Okay, thank you. There's a quick question on whether there will be a new edition of the SPAR tool. Yes, it will come, but for this year we'll use the original tool, and then I think by next year, 2026, we will have the new approved SPAR tool with all the changes incorporated in the STAR tool. There's a question, I think any of you Ahmed, Mamadou, Fatima can address. It is inquiring whether once you have designated a POE, you can designate it, because there are changes that happened here and there, and can a designated POE be designated? In other words, no longer a designated, changed. Over to you, colleagues.
Okay, maybe I can take and Ibrahim could add.
Yes, please.
So we can understand the situation that, sometimes the member states, they may need to modify or change the designated points of entries. We have some examples in our countries, in our region, that there is conflict and the points of entry that they have previously designated, it's not operational anymore. So they need to change that. That's why annually on this bar that you're reporting all your designated points of entries. So you can report and you're filling another Excel sheet on the capacities at each designated points of entry. So you can update those designated points of entries annually and report to WHO during when you're submitting the SPOR results on annual basis on overall IHR capacities. Thank you.
Okay, any addition from any of the other colleagues?
Yes, thank you. Just as Fatima said, just to reemphasize to colleagues, the process of designation, in a way, we can think of it like a prioritization or maybe a resource prioritization process. What you are saying when you designate is that you as a member state, you're going to ensure that those POEs you have listed as designated have all the capacities required to tackle multi-hazard, multiple types of hazards, which are biological, chemical, radiological. This is why the guidance on designation gives you some factors where you would like to consider which POEs, either airports, seaports, and even ground crossings you want to designate. Of course, these capacities, we expect that even if you have made all your designated POEs reach that high level, you also extend to other POEs to also build their capacity. But in a case where a member state sees that they have done too many listings for designation, and as Fatima says, wants to reduce that number, that process can be done through the process Fatima said, and you resubmit a new list of designated POEs.
Okay, thank you. Now there's a question, I think somebody can also address this on yellow fever vaccination. I think let one person clarify on this. Yellow fever vaccination, can the card expire? Does one need to be revaccinated? I think that you clarify this regarding the yellow fever vaccination so that it is clear for everyone. Sarah, you are welcome. Sarah, do you want to take this question on?
Thank you very much, Miriam. I think that question has already been answered by my colleague Fatima. I just wanted to mention one thing related to the previous discussion on designation, because this is an issue for which we have received many questions, particularly I would say from the African region. And indeed, it was upon the request of member states in the African region that we developed the technical brief on designation of points of entry, which Fatima has pasted on the chat, and I believe it's also included in the slides that will be shared afterwards. So I really do encourage participants that have still questions around designation to look into that. It's only a 2-3 pager, but it answers the most commonly received questions. And as Ibrahim mentioned, it explains the rationale under designation. Why do we speak about designation of points of entry under the IHR as a way to prioritize what is often limited public health resources towards those points of entry that have certain factors that make them more likely to experience a public health event, but then also some of the limitations of this concept as well. And the idea that even if we do prioritize those points of entry that are that have, for example, the highest volume of traffic, then that doesn't mean that other public health emergencies may be occurring in other points of entry in our country. And that's why we often speak about border health strategies that take into account this complexity throughout the entire territory. So I just wanted to mention that and encourage colleagues to look into that publication. Thank you.
Okay, thank you very much. Walter is asking if the JEE questions will also be, if the JEE tool will be changed, yes, it will be changed. But as I said, probably not this year, but it will be changed in the course of the year, and countries should be able to use it next year. Okay. There are so many questions. We thank you for all your questions. We've tried to merge as many as we could. The team will continue to answer the question, those that have not yet been answered. Lastly, there's a question on whether there are any provisions for support of POEs during the recovery phase. Oh, Fatima, you're taking it up?
Okay. Yeah, I think our colleague Ibrahim presented the IHR core capacities that needs to be in place in routine times, but also during response to public health emergencies of international concern. So the one in routine times, so it should be in place all the times, no matter if there is an emergency or not. So that's why please have a look at those core capacities. So they need to be in place at all times. And the ones specific to response to public health emergency of international concern. So those are additional capacities that needs to be in place during the emergencies. Thank you.
Okay, thank you. I see in the chat a question on the difference between IHR authority, IHR focal point. We covered this extensively last year. We can share with you the presentation for your attention. Lastly, is a question about financing and capacity building. What are the key financing and capacity building strategies or options to support the low and middle income countries to build these POE standards? So, anything? Hamid, Mamadou, Fatima, Sarah, any idea about funding? One, yes, is the pandemic fund, potential for funding from the pandemic fund. Yes.
So I can start, Dr. Mariam.
Yes,
So,
please. Yes.
you recall our last webinar discussion on the different amendments that support I mean, shaping the financial architecture of health security, in particular Article 44 bis, which establishes a coordinated financial mechanism, as well as Article 54 bis on the IHR implementation committee. So putting into consideration also the pandemic agreement on the ongoing negotiation on the different elements of the pandemic agreement that include a sustainable financing provision as well in Article 19, as well as the potential complementarity between the conference of party, which is established under Article 20 of the pandemic agreement, as well as the subsidiary bodies that is will be developed under the IHR amendment. That is a good opportunity to align funding for different core capacity for the international health regulation. I will give the floor as well to Dr. Ibrahim to complement that, and Roberta as well, because she's in the call.
Oh no,
Okay.
I think Hamid has captured what I wanted to say. Just to remind member states that the pandemic fund applications are ongoing, and cross-border POE and border health are very critical components of strengthening health security in your countries. So we are hoping that a lot of the support can go towards that. Back to you, Dr. Miriam, and maybe Roberta.
Okay, finally to you, Roberta, and then we move to the next session. Roberta, please.
Yeah, thank you. We already addressed a bit the financing aspect last week, And overall, in the amendments, there is a call for both domestic funding, enhancement of domestic funding, because the best strategy is the strategy to build and maintain capacities that the country itself design, because nobody else knows better than national authority what is needed, when is needed. And then this is the very first point, taking ownership of what is needed. Two, once it's clear to national authority what the strategy is, what is to be done because it's needed, then in the IHR, countries, they laid the foundations to leverage on existing funding. At present, the classic funding mechanism that is available is the pandemic funds, and there are some projects that are focusing on points of entry. This is where we stand now, but the message really is national authority taking ownership and identifying their own need, not to be carried away in unnecessary initiatives. Over.
Okay, thank you very much. Colleagues, I think we have tried to answer as many of your questions as possible. Thank you all, panelists. And I request kindly that you type the answers to the unanswered questions in the Q&A. Thank you very much. So now we will move on to our next session, which is about the domestication. Dr. William Onzivu, over to you, please. And please remember that we are lay people, make it as clear as possible to us who are not lawyers. Over to you, Onzivu, please.
Okay, thank you. Sorry, I'm trying to. Are you able to see my my slides?
We can see the slides, but they're not in slide mode.
Okay, let me take it down then. Are we fine here now? Is it in slide mode now?
Okay, but for me, I see as if it's not yet in slide mode on my side. But what are other people seeing? Mamadou, are you seeing slide mode?
Not yet. It's I think you can click on the slide mode at the bottom.
And that, gosh. Let me start again. Do that. That is still the same?
Let's see, we are waiting. Yes, it's still the same. So can we have the Parallel group or to share for us?
Do you want to hold for just a minute and I...
Okay, you're almost getting there. You're almost getting there.
Just a minute.
Does you have two screens?
You now have two screens.
Let him remove one screen, I think.
Yeah.
Click on display setting. This display setting. The one in middle.
Yes.
Yes, display.
Yeah.
Duplicate slide.
Is that better now?
Yes,
Yeah.
good. Now we are ready to go.
Okay, sorry about that. Yes, this presentation really focuses on the legal aspects of the IHR implementation at the national level. I use the word domestic because the IHR, the amendments especially emphasize now the national, but some elements are the subnational, you know, where we talk about the local, community, and intermediate. So the presentation has an introduction, which will define domestication, some of the next steps, which I think many of you already know because your countries are going through that, and amendments and the IHR as a treaty. And then the role of domestic law in IHR implementation. What does domestic law have to do with this? And what are those pathways of domesticating treaties, but also specifically amendments? And then some of the key areas for domestication and examples of what countries could consider doing based on precedents, really. And then there is a part on practical considerations for legal reform, because legal reform is very critical in translating what is international into country context. And then, of course, we sum that up with a series of pillars for implementation actions, which are actually measures that need to be considered in any legal or administrative framework for that matter. So this timeline, I think you've seen it before, and thank you, Miriam and team. I picked, some slides from you here. This is not my slide, but this is the timeline I think you're going through, countries are going through right now. But I just wanted to highlight some things here. The deadline in July was that countries needed to make some adjustments in the legislative and administrative arrangements to domesticate IHR. And of course, with President, I know that this is a progressive thing. It's ongoing. Very important because looking through the IHR, of course, the conception for a long time, many have always seen the IHR as just a technical tool or an operational document. But we can see that the issue of legislation and also administrative arrangements are important, and I think that will be highlighted in the next slides. And of course, you have the deadline of 19th September, where a number of things are supposed to be done. That domestication is expected to be completed around that time or thereafter. And as to whether any country has done that, because normally domestication is a progressive process. Of course, there are some exceptions where countries put into place all their structures even before fully becoming a party. That exists in some countries. Of course, with the IHR, with the COVID, I know a lot of countries have done that, but in terms of the amendments, it might be that some further work needs to be done, and I think that's the focus of this presentation in context. So in terms of definition, domestication is really those procedures and actions that a state needs to take to incorporate the rights and duties contained in a treaty, and which can be applicable and enforceable within its domestic legal system. From the legal perspective, if you cannot enforce any rights or any duties, then it hangs in the balance, and there isn't a routing for that. And I think domestication then becomes important in this aspect. So in terms of highlights, I think you've all talked about this, and I think you are all aware, because we are all reading the IHR, and I think we have to continue reading it. I think that's the message here, that there are a few highlights of the amendments. For example, the pandemic emergency beyond the public health emergency of international concern, which has been established in the amendments. And of course, that kind of does not change the processes as such, but it does give a hand, of course, to the Director General to make that determination, just like the others. But it kind of raises pandemics to another level. I think you're aware about that, the access to health products. And I think that is tampered with or integrated with the issue of equity and solidarity as well. I think previous speakers mentioned about that. And then the financing element, the coordinating financing mechanism, and how that actually will be able to link to efforts to prevent, prepare, and respond to public health emergencies. And of course, some of the new obligations, especially the core capacities in Annex 1, as I mentioned before, is no longer just focusing on the national, but it goes to the subnational levels. Some of these implicate, the role of law. Very important, of course, is the implementation mechanism. This one, is not necessarily a domestic matter, because it's at an international level body. But of course, there will be experts coming from the domestic level. That this is not a typical sort of mechanism in other treaties where there is the element of compliance and enforcement tainted with it. This is a very consensual body and supposed to extend best practices and all of that sort of requirements. And this is very important. And then the creation of National IHR Authority, I think this is one where there is need to critically look at the legal architecture and the issue of powers, the issue of mandates, the issue of sectors, and so on. And this is a new development, I think, when it comes to domestication, when you look critically at that. The digital health documents, again, this is very important. There is a statement in the principles about really integrating IHR in other health regimes. That's when you are considering health, policy and legislation, you should think about the IHR as well. That calls for mainstreaming. That these are elements of mainstreaming. Again, that's where law plays an important role. And then the principle of equity and solidarity. Again, very, very important new areas. So the question always is IHR a treaty fully subject to international law? It's just partial. As I mentioned before, the commentator said it's not really, you cannot compare it to the Framework Convention on Climate Change, yes. But treaties have nuances. But the question is, are they subject to international law? And under the constitution of the WHO, Article 21, and of course, you compare that with 19, these are two pathways for adopting treaties. And IHR has been negotiated under Article 21. That doesn't make it less of a treaty. It is still a treaty, and rules of interpretation are there. Of course, there are some nuances. A lot of these nuances are technical in nature and is the history of the IHR. But it's very important to consider that IHR is also a treaty subject to international rules as well. And then if it's a treaty, and then the mother of all treaties is called Vienna Convention on the Law of Treaties. And this one lays a number of rules on how treaties should apply and how countries can interact with them and how they could be applied in domestic laws and so on. And so it's also important not to forget that the Vienna Convention is applicable here. And the Vienna Convention does provide for amendments under its Article 39, but also it says amendments can be governed by this, except where the treaty itself provides otherwise. And in the case of IHR, we know that there are provisions. I think Article 55 of 2005 IHR does make that provision. Yes, here there is the procedure which has been concluded now. It's still on actually until it's entering into force. I think this is what we're living right now, the procedures. And again, when it comes to the Vienna Convention on Law of Treaties, it says to domesticate amendments, it has to follow the same pathway like the mother treaty. So amendments are no separate. Even if it's like one provision or two, it still has to follow that pathway of domestication. So you cannot say we just have one and we can't do anything with it. And I think that is what we're doing here. That's why we are considering the issue of domestication just based on those amendments. Somebody will say these are not too many, but they are very fundamental in legal terms. So in relation to that, another question is, what is really the role of domestic law, existing domestic law or a domestic legal system in transposing the international health regulations? Looking through the IHR the amended IHR, I looked through, and they are close to about 20 times where the issue of legislation or law is referred to expressly or in some cases implied. And so that really highlights the importance of legislation or domestic law or law generally, whether international or domestic, in the application of the IHR and its implementation. Those are mentions which are deliberate. They are not by chance. So I think it's important to look at that critically. And then a lot of the requirements that countries are supposed to implement at the domestic level, such as core capacities, funding, establishment of the national IHR authorities, collaborative actions between the different sectors, and in some instances, even though the IHR is not enforcement and compliance heavy, it's a soft treaty in a way, there are still certain aspects at the domestic level that will, require a sort of compliance measures. And I think that is where domestic law becomes important. And of course, we know that as a treaty, the regulations confer rights and obligations to parties, and parties can only realize this at a domestic level. Of course, the reality is that not all the requirements, the IHR, have to be domesticated. For example, the powers of the Director General, you don't have to domesticate that. There are a number of other aspects that doesn't require domestication. And one could try to also argue that there are nuances with the administrative measures of domestication. But I must also state at the onset that a lot of administrative measures are based on powers conferred by law. A minister, for example, cannot simply take a decision in a country if he doesn't have that powers rooted in law. And so it's important to look at that aspect as well. And the Vienna Convention is very clear on that. It says parties, after becoming, parties to a treaty, they really need to operationalize those requirements in their domestic system. And if you look at the current IHR Article 59, Part 3, I think that is implicit in that. It talks about the two strands of legislation and administrative measures. And those may look separately, but at the domestic level, sometimes those are gray areas. They get fused together. As I mentioned before, administrative measures may be based on a power conferred by law. And then when it comes to what are the different options to domesticate the IHR, you will need to look at the constitutions and the statutory legislation that exists either in health or maybe in other sectors, the regulations and the administrative enactments, or they could simply be administrative measures rooted in edicts or in sort of administrative circulars and so on and so on. So I just wanted to strengthen that to say what will be the role of domestic law in implementing, especially these new amendments, which are part of a multilateral treaty. I call IHR a multilateral treaty because we've got many parties here, not just two parties or few parties. Is really to transpose and strengthen the substantive. Those are the different requirements. We talk about port of entry, core capacities, all of that. And some of the institutional aspects, because in the IHR, there are a lot of requirements to have institutional measures in countries. And also it involves a lot of procedures. That's why in IHR implementation during COVID, you have all these SOAPs. The SOAPs have to be prepared and they will continue to be developed. And so at a domestic level, it becomes very important to look at that because that is very important. And then to redress policy fragmentation, the reason is that if you look at the sectoral mandates in implementation of the IHR, health is just one of them. But you've got transport, you've got civil aviation, you've got environment, you've got probably agriculture, you've got customs, and law enforcement, for example, all of these. And fragmentation is a very notorious problem in our countries. And legislation is one of the ways to be able to align that. And I think in terms of IHR implementation, that becomes also critical. Political prioritization, especially where it comes to allocation of resources by parliament and or by the executive, whichever bodies. And I think they say what is written in the law is probably a priority. What is not in the law may not necessarily be a priority. And especially when it comes to parliamentary budgetary processes. And so it becomes important. And then crystallizing commitments at a subnational level. Of course, in many countries, the local governments are responsible for the subnational level, you see. And they have their own legal frameworks. The Ministry of Health, of course, works with them. And sometimes there's already a proper harmonization, but in some countries, that harmonization may still need to be looked into. And then there is the question of interpretation of an international instrument in case of conflict, in case of a challenge. It's very important to have that basis because somebody could argue you cannot use the IHR because show me, pinpoint to me where it's part of our domestic law. Has there been a statement to that effect? The judicial notice simply becoming a party at the international level is not automatic. we know this, it might be very legalistic, but at operational terms, it might be very important at some point. And so it's really to have that legal predictability, also operational predictability to be able to address these issues. So what are some of the pathways in domestication of treaties, which applies to IHR as well? And I think there are some existing practices, which also are legal principles, also the legal practices. One, of course, is that treaties have to be performed in good faith. And then you have the importance of constitutional law and specific domestic laws when it comes to treaties. Some countries have that. And stemming from that, these two traditions, which I will try to explain a bit more, what we call monism, dualism, and hybrid mechanisms. And then you have the overall legal reforms in countries, and then the de facto or practical implementation of IHR requirements. So good faith is a statement provided in the Vienna Convention on Law treaties, and it really underpins a lot of treaty practice by countries. They are saying, if a country has decided to become a party to an international treaty in good faith, they must implement it. They need to implement that. In other words, it's a way to encourage countries to say, well, you go for a buffet, don't just pick and choose them, eat everything. Good faith underpins that. And it's an important element, especially in IHR and a number of international treaties where the typical compliance mechanisms are not there, where countries are kind of cajoled and pushed to take matter, but rather it is out of good faith that they will perform that. And so it becomes a very important element when you're looking at consideration. And then, of course, the parties have to consider their constitutions and other domestic law. Some constitutions, most constitutions, I think all the constitutions have something on the treaty. And it's from that constitutional provision that you will see whether the treaty is directly part of the domestic law when a country has become a party to the IHR, or they have to enact another legislation to be able to domesticate it. I give example of Kenya, which recently in their 2010 constitution made a provision that every treaty that Kenya ratifies become an automatic part of the country's domestic law. That's not the case in most of the countries, a number of countries. And of course, we have the other countries that I'm going to talk about, where it may be mixed system, where some treaties are automatically part and some you need legislation. So one of the key approaches is this, what they call monist approach, which is the direct application of treaties in domestic law. If we have lawyers here from the French-speaking countries, I think they know this tradition that a treaty can be invoked, for example, in the courts of law, as long as the country has become a party and through its processes has actually ratified it or acceded to it. And this reflects the fact that a treaty can be self-executing. In other words, when it becomes part of the domestic law, it can even override existing pre-existing domestic law, and so that becomes important. Countries like Benin, Senegal are examples, but most of the French-speaking and Portuguese-speaking countries follow this tradition. And again, I must caution that that is not always a strict reading, because there are still some operational requirements, even though the treaty is part of domestic law, where laws need to be adopted, But in terms of strict sense of saying domestication, they will already domesticated it directly. That is the approach, particularly in French-speaking and Portuguese-speaking countries in our region. The dualist approach is different. It says a treaty has no special status in domestic law until there is a domesticated law, domestic law adopted to incorporate those international requirements. And it does not necessarily have to be a statute. It could be just regulations, to provide clarity. It could be just amendments, but there has to be some second layer of legislative action besides ratifying at the international level. And Uganda, Tanzania, Malawi, a lot of the English and Commonwealth speaking traditions follow that. And then we have the hybrid approach, where some countries will have provisions to domesticate the treaty directly, such as in Kenya, but there may also be situations where they need to have a comprehensive legislation to be able to fully domesticate the treaty. And underpinning all of these, with all of these considerations, the practical and more immediate thing to do is legal reform. As I've stated here, legal reform is a permanent enterprise of governments. In every country, there's a legal reform agency constantly looking at laws. And so when something comes like this, it's always good to try to pass this through and see whether there may be need to do that. And of course, they will review the constitutional, sectoral laws. There's need to review all of the sectors that have a mandate on the IHR and all the mandating laws there to see whether they are relevant, whether something may be needed there. There may be no need for adjustment at all, but reviewing is important. And it's not just the law, but looking at the institutional mandates, the powers, the substantive requirements, and powers to take action, because that's very important when it comes to taking administrative measures. Who has the power to take action and how could they take it? And if you want political prioritization at a high level, where do you go? Where do the powers lie? And I think these are some of the things. So besides that, I just wanted to go to some specific examples of what countries could consider doing based on the specific measures in the amendments. Article 3.4, subsection 4, has a provision on that parties have a right to legislate, but they should do this to uphold the purpose of these regulations. In other words, this seems to be a provision that is requiring parties to mainstream the issues of regulations in other health laws and policies. If there is a reform of Public Health Act generally to cover everything, it's important to take care of that. It could be a reform of civil aviation rules. It's important to take care of these, which could be other things, but those are related to health, you see. So I think this is kind of a mainstreaming requirement that parties are being requested to do. And then how could they do that? Of course, the obvious thing is to have a working group of legal and technical experts drawn from sectors with a mandate on the IHR or law reform agency, and making sure that these recommendations, of course, will be applicable to each country's context, and providing for mainstreaming of international health regulation, other health legislation. In our countries, there are many examples of legal mainstreaming in national law. Human rights, they say mainstream human rights in other areas of law, mainstream climate change rules in your areas of law, and so on and so on. This is there's a good practice to follow in that regard. And I think one of the most pivotal areas is the National IHR Authority, and the provisions in Article 4, Part 1 established this body. I think we are clear with that. But there are some statements in the provisions. It says state parties shall take measures to implement the paragraphs which is established the National IHR Authority, and adjusting their domestic legislative or administrative arrangements in this context. So I have seen a lot of documentation and even some guidance that was prepared by the WHO. It's really to say, how can you prioritize this and take it at a higher political level? And in experience and in practice in our countries, the higher the level you take it, actually, it becomes, very important in terms of recognition, in terms of priority. And it might be that the cabinet does not have to do the mundane work of this sort of exercise, but it's important to institute it at that level. And then the technical staff from the different sectors with the IHR mandate can take that on and have a way to be able to report, of course, through the Minister of Health, the cabinet, or whatever it is. Because to me, that is the way to be able to prioritize this sort of reform at a higher level in terms of creating institutions, if you want visibility. And there are precedents, again, of having these sort of working groups. It could be senior technical level in terms of delegated authority to do that. It could be ministerial. There are cases where prime ministers have been able to use their powers to convene these sort of bodies or to establish them. Or it could be a proper statutory enactment to be able to do that as well. And so all of these are options that countries can consider. And of course, in some countries, it could be as simple as the health minister be able to do that. But mind you, we're dealing with a subject that is a mandate in different sectors: transport, transportation, civil aviation, and many others. So that is some of these things. How do you ensure that the delegated person has the relevant powers, but also there is a possibility of parliamentary oversight? And I think some countries, of course, statutes automatically go to parliament, but not in every country do regulations go to parliament. But I think there is no bar in making sure that even regulations can be laid before parliament, so that the parliament is kept in the loop, and when this comes before parliament, they are able to take notice of it, because there's need, what they call taking legal notice. It can only be done by gazette statutes and of that, so that the parliament is also engaged in that. So in terms of the health documents, I think it's really reviewing the applicable law. A lot of these things are to do with privacy laws and confidentiality, and of course ICT legislation has also sometimes been harmonized. Sometimes it goes contrary to what on privacy issues, and so that is a requirement. Just a bit, sorry. Okay, so again, this is what I could say with digital documents. I mean, it's about privacy laws, constitutional, and also ICT legal reforms happening in many countries. As you know, government is becoming digital, the countries are becoming digital, and so that becomes an important area of law to look at. So in terms of processes, what could be done? I think these are important because legal reform is not just looking at the law, it is the other aspects: public participation, multi-sectoral coordination to make sure all the other sectors are involved, and possibilities for consultations. And so some of these activities that are here are really to be able to do that. You cannot develop a law in silence in your, in ministry rooms. It has got to be out there, and to be able to get feedback and those sort of activities. So convening key stakeholders or identifying implementation gaps, developing a plan, of course, that would be the institutions, but advocacy materials or finding legislative champions. These are things that have to be done alongside the strict legal review. Technical assistance is important. I think that's what WHO, the Secretariat, has been doing and has been supporting countries in the IHR implementation since then. They will continue to do that. Political prioritization, again, as I stated before, this is taking issues at a higher level and making sure the engagement is at a higher level. Coordination of all sectors, and then comprehensive legal analysis with clear recommendations for reform. And of course, it's looking at whether you're amending existing law, new legislation, is it regulation, is it any other domestic legal notice? It could be an administrative enactment. And of course, all this requires resources. And then some of these, again, these are sort of trying to encourage participation and also elicit support at a high level, because this will be kind of required in that regard. What are some of the things that should be considered? Revising national legal frameworks. It could be also developing guidelines alongside that, and the development of SOAPs as necessary to align with amended IHR. So it's not just legal frameworks. You remember the IHR says legislative or administrative instruments. So that is the importance with that. The legal framework should support and enable all the state party activities and activities of the authority, and it also could include provisions for budget. Of course, this is when you have decided which way to go, and I think it's important to have these key provisions in there. So in terms of really bringing this all together, I think we talk about the need for a small sort of consultative working group within ministry. Even ministry has all of these available, and they are able to have their structures to be able to deal with that, then that's fine. But again, this was a call to kind of prioritize this at the highest level. And I think this is where it becomes important about the relationship to cabinet and authorize them to do that. And the membership of such a technical working group should not just be, of course, health, but it has to be all of the other sectors. In our countries now, there are legal advisors assigned, to support every ministry, for example. And it's important to look out for those when you consider legal reform that sort of draws different sectors together. And really, at the end of it all, it's really that decision which is important. And I have highlighted something here, drafting instructions. The lawyers want to see this. You can do the talking, you can say we're going to do that. But if you want to change something in the law, whether it is regulations, whether it is statutes, the legal advisors need to see the drafting instructions from, whether it is the Ministry of Health, whether it's a multi-sectoral body. And so at the end of it all, surely in our countries, we should be able to see some sort of drafting instructions on the amended IHR in terms of what is needed to be domesticated. As I mentioned before, not every requirement of the IHR has to be domesticated because they're already existing laws, and some of these are very international, for example, the role of WHO and so on. But somehow for amendments at domestic level, the Ministry of Justice are going to be waiting for drafting instructions on the IHR, whether it is going to be amending some statute, whether that is practical, of course. From my experience, because this is not a very extremely wide-ranging amendment, I think powers under an existing law will help to speed things up, adopting regulations, because that's a quicker way to move things. Because amending a statute takes a long time. It still has to go to Parliament and follow kind of long processes. So this is kind of like the concluding sort of set of PowerPoints. These are just some of the things that, whichever way the reform will take, whether it is statutes or regulations, some of these implementations actions have to be rooted in a sort of a framework. It could be policies, it could be administrative ethics, and a lot of these, as I mentioned before, require inclusion in a kind of a legal framework. Of course, the establishment of a national IHR authority, it should be mandated to coordinate national implementation. Sometimes coordination has to be written into the law, unless if there is an existing mechanism of coordination that has been working very well. If it does, that's fine. But it might only be working well because of temporal conditions, good minister, good technical staff, and whatever. What if it changes? And so some of these things have to be written into the law. And then the issue of budget, the issue of channels of communication, I call these are procedures of communication. And then also the relationship with a national focal person. Some of these may already be there in the existing administrative arrangements or law, and each country will have to look at that and see what needs to be amended. And I think I stressed a lot on that, and these are some of the sectors here: environment, transport, and security, and others. And again, these mechanisms best rooted in law, and of course, relating those standard operating procedures in that regard. I think the core capacities becomes important because in the new amended IHR, you have the local level, where intermediate, you have the national. And as I mentioned before, in some countries, a lot of issues are they are devolved. You have health issues addressed by devolved governments. Kenya, you have counties and all of that. So I think, again, legislation can play an important role in terms of the role of harmonizing the public health laws with the local government laws, and how these new requirements will interface with that in terms of service provision and what might be able to change. Again, this requires that sort of review. The issue of international collaboration, again, it's something that can be written into domestic law so that the country can make sure that in cases like this, there is that requirement. Of course, we have sub-regional organizations that already promote collaboration in health. And that depends on what duties may be required at domestic level. And so this is again something that has to be institutionalized. It has to be predictable in a way. Information sharing, again, these are things that already have been done technically, and it could benefit from, making sure there is at least a basis for it. It could be legal, it could be an administrative basis if it's not there yet. Again, subject to review. Financing, again, making sure that there is a budget for these amendments is very important, and this can be written into the law. And again, parliaments in our country cannot just take notice of anything. And the question they ask is, what is the basis for asking money? I mean, we know it is there, but has it got a legal basis in our country, or some sort of a basis for financing? As you know, budgeting is kind of prioritization issues, and there's a lot of challenges with that. Monitoring and evaluation, of course, I think many talked about this. I mean, this is something you've already been doing, and the JEE and USPR and many others, you've already been doing that. These are kind of reviews which are important in identifying gaps as well and helping to plug them. So in terms of going forward, I think the importance here is one of progressive legal reform, and making sure that the institutional, multi-sectoral strengthening actions, capacity building are all kind of reflected in the pillars, reflecting the pillars of the IHR, and they have been implemented at the country level, at the domestic level. And just a comment in terms of this exercise, I think it's important to be futuristic here, because you have the pandemic treaty, which is just next door, and indeed there are linkages with that. And we know in our countries the talk of regulatory fatigue and also governance fatigue in a way when it comes to all of these competing demands. And so it might be good, without attempting to jeopardizing the timeline of what we're supposed to do, to also think futuristically in terms of the legal reform we're doing when it comes to institutions and so on, to try to look at that. But as I mentioned before, law reform is really a permanent enterprise of government. So there shouldn't be an issue with, when new issues come, but this is about trying to look at efficiency and what might be leveraged here. And of course, they say, know your IHR. I think that's a booklet, you can do that, know your IHR. The Fool's Guide to IHR and all of these. I think this is all very important when it comes to the domestic level, because now IHR is, saying people in communities and districts must also, their pattern, they need to know this huge document, isn't it? And some of these, I think, work you're already doing, Secretariat is doing. And then engaging the leadership on the discussion and following dissemination of that. Of course, the higher level, the better, and of course, technical and, whatever is efficient, what can work quicker. And again, this is what the technical working group that could be considered quickly created can actually do. And developing a roadmap for domestication. There are many other activities that will need to be done down the road. Domestication, it's a bit of a policy legal aspect, but also there's the de facto implementation. All of these have to be considered. Really, some of these reviews, external evaluation and others, I mean, this can all help to strengthen the capacities. And of course, sometimes you don't have to necessarily go to legislation. Maybe a policy can actually do in the interim, and where there are requirements then to add certain aspects in legislation. It's all progressive. I think the question is about making sure this process, the momentum is accelerated, and roadblocks are not created, and whatever is possible can be done. But and just to ensure sustainability, legal mechanisms at domestic level are very, very important. They should be considered. They should always be looked at, and of course, alongside administrative measures, which might be a quicker route to implementing some of these things. So that is really the conclusion. It says 19th September 2025. I think that's a D-Day, and I think countries will be looking at that and anticipating what next actions they'll need to do. And I think I stop here. Just a few resources. Of course, I looked at many, but I'm just giving these few things to say I picked some things from here. And to say thank you, merci a tous, and obrigado. Thank you.
We've lost the moderator, I think. Miriam?
Yeah, I was actually waiting. I thought I was the one who probably got lost and you didn't hear me, so I was getting worried.
Dr. Nanyonja, please. Well, we could take some questions now. But Miriam, where are the colleagues in Nairobi?
Let me quickly step in.
Yes. Oh.
Thank you very much, William, for that brilliant presentation. And I think you have given a lot of insights on the current processes and what we have achieved so far. So without wasting any time, let's take a few questions. Colleagues, like we said, feel free to either put the questions in the Q&A provision, but also feel free to raise your hand, and our IT team will give you access to asking the questions. I do not see any hands up, but we have some few questions in the Q&A section. Let me try and open. Okay.
Hello?
Most of them have been answered, but maybe we just need to re-emphasize a few of them. I think there's a question by our colleague Ilham Siding, who is saying, what if countries reject IHR and pandemic treaty? How do the challenges resulting in that effect affect the rest of the globe in managing pandemics and border health? I see Paul and Michael. I've tried to answer them. Paul, do you want to come in briefly, and then Michael can re-emphasize?
Roberta's is unraised.
Okay, let's first take this, then we shall come back to Roberta's. Paul or Michael, do you want to come in?
Yes, just shortly, I provided a response in the chat, but there will obviously be negative implications for all member states because, like Dr. Ajabeng says, we are a global village, so diseases, epidemics do not respect borders. So it would be to the disadvantage of all of us. That's just my short answer. Thank you.
Okay, thank you. And Michael continues to say, Michael, you want to come in?
Yeah, thank you. Maybe just to reiterate a bit, international response to all some of these emergencies definitely needs a concerted effort. So if we are all on board, the better the network for early detection and this concerted response that we are talking about. So all our countries definitely are encouraged to be parties to this agreement. But in the event that a country decides to abstain, these are the ramifications we just mentioned. Thank you.
All right, thank you for that. Roberta, you want to come in? I see your hand is up. Please go ahead.
Thank you. Thank you. It is a reality that a number of countries, of states parties have rejected the 2024 amendments, and some of them had already rejected the previous set of amendments in 2022. Then we are in a reality where technically we have different sets of IHR provisions applying to different groups of countries. And obviously there has been a sort of creak in a sort of fracture in the integrity of the text of the IHR, and which was his strength, maintaining the integrity of the text of the IHR was the basis for the IHR to be universal. Now we have to sort of piece things together, and from the WHO Secretariat perspective, the message that we would like to convey is that if we want to maintain some sort of common rules and common framework for all to be predictable, to respond effectively, to detect and to share timely the information, then there will be a need to all the parties to exercise some sort of flexibility, and this will need a lot of more dialogue than before among the different countries. Then we are in a difficult situation, a call for flexibility, and a flexibility that can only be sort of established, maintained, and implemented with more dialogue than ever than before. We'll try to put this in writing, and the Director General will try also to convey that message. Thank you.
Okay. Thank you very much. Just trying to see if there are more hands. Colleagues, feel free to raise your hands and ask any question. This is a very, very important session. And also the panelists, in case you want to emphasize anything, please raise. Dr. Talisunda, over to you.
Yeah, I just wanted to first of all thank Onzibu for this very critical presentation. And those of you who have done the joint external evaluation, you actually find that when we assess in the JEE, one of the first things we assess are the legislative instruments. If you look at the JEE Tool 3, we assess whether the country has conducted legal analysis, legal mapping, and legal assessment, and so we grade from 1 to 5. So, and then the second attribute that we assess is issues around gender equity, equality, and in health emergencies. So it's really critical that countries do this, because most of these assessments then result, when we did JEEs previously, we found, for example, that the public health acts were so outdated, if I can use. The animal health acts were so outdated. So you had to review them. They were probably not contemporary enough to review, to implement the IHR. And like Dr. Onziva said, the multi-sectoral nature of the IHR implementation requires that you look at either legal policy frameworks within the different sectors, animal health, human health, environmental sector, but you can see transport, security. So it's really broad. So it will be very nice that as we move through JE's Wave 2, we look at how we have progressed in terms of assessing the available legal mapping of the legal instruments in the country, and making sure that we align those legal instruments to facilitate the implementation of the international health regulation. The second issue that I really raise, I mean, countries, of course, it's their sovereign right to not to endorse the IHR. I hope that we'll have very few or no objections from Africa. And Robert, I think you can say we have very few. So far, by the deadline we hadn't got any reservations. But it's really, this is a global instrument to protect each other. And I've always said that a health security risk anywhere is a health security risk everywhere. Nobody is safe unless we are all safe. And I mean, you have seen COVID-19. I mean, even the most developed countries were the most affected, and partly for us in Africa, because we have had all these public health emergencies on and off. We've tried to build capacities. We've tried to set up coordination mechanisms. And we had tried to transition from people understanding the national focal point as a person to broadening them to be a center. And now as we shift to the National Health Authority, we need to think on where do we locate it, because it's suprasectoral. it's really going to be, how do you bring together multiple sectors to be able to implement the amended IHR? So again, I mean, it's a member state's right to endorse or not endorse or to comply, but at the end of the day, it's really for us all to be collective. It's global solidarity for us to protect each other, and being my brother's or my sister's keeper is really the way to go. And I would appeal to African countries really to make sure that we embrace the IHR, and we have seen we are prone to outbreaks, and they cross borders. And so if one country is weak, the whole continent is weak. That's my observation. Over.
Thank you very much, Dr. Dalsuna, for that addition. Very timely. I see some questions regarding One Health. I will request Dr. Traore Tiebe to answer them. One of them is about One Health agenda. What is it all about? And then the other one is, if you can first take that. Dr. Tiebe, are you online?
Okay, thanks, Dr. Allen. Yes, as Dr. Dalsuna just mentioned, that multi-sectoral One Health collaboration is an essential part. And IHR monitoring and evaluation is done using the One Health approach. And joint external evaluation, for example, you have seen how animal health contributes to it. And even environmental health sector that was decided in ministerial meeting in Dakar. The report is available. They need to contribute into that. And the NAPS, which is the National Plan for Health Security, it's elaborating using One Health approach. The global agenda, what we talk about now, the 6 action track, whether it is One Health capacity building at country level, a reduction of risk for emerging pathogen and vector-borne disease, food safety, AMR, environmental context, climate change, all are addressed in the joint plan, the One Health joint plan of action, which cannot be implemented without the health security. It is just impossible. And so IHR play key role, and it is a framework as well. It was known for One Health approach. Yeah, thank you. But we can always support a country to build the multi-sectoral collaboration, which, for example, with the national authority coming into force, and this is a great opportunity to address the One Health approach at all levels. Thanks.
Thank you very much for that. And I think most of the questions have been answered. I see there are over 30 questions, and the question that you have just provided is also related to the third question. It was also around One Health and IHR, and I think you have mentioned it well. So, Dr. Onzivu, do you have your last parting shot before we go to the next step? Anything you want to add, re-emphasize?
Yeah, I think it's just in this work, I think the work outside, as I said, getting every sector aware about the IHR, especially not just the other the sectors with a mandate, but also the legal sector, because at the end of it all, if there are going to be laws to be drafted and developed, it's the Ministry of Justice that needs to be always in the loop. And of course, I take note of the non-parties, which sometimes we call the free riders, who are ready to reap the benefit wherever it is possible. I don't want to be a party. I mean, that is something in many treaties. And I think the inclusion of equity and solidarity in the IHR, I hope that that can be operationalized, at the international level, so that really people realize it's the global neighborhood. So that's really my last comment. But yeah, thank you all for your comments. Very, very instructive, and I appreciate. Thank you all. Thank you.
All right, thank you very much. Thank you, Doc. And, great presentation. Very precise. We shall share the presentation for the participants to read through. Any last parting shot from our panelists? If any, you can raise your hand. Okay. I don't see any comment. I think we are way behind the schedule. We are already across the 2-hour mark. Just to let you know that we shall share with you all the presentations on email, but we shall also send you a survey link for your feedback. Like we said, we treasure your feedback, we treasure your follow-up questions, and we can always reach out to you. Feel free to ask any question anytime. And also just to know that this is a series of webinars. So on 20th August, next week, same time, we have another webinar to talk about the new amendments. And please attend in large numbers and share also within your cycle, just like you have done today. Today, the presentation, the attendance was quite impressive. Before I conclude, just to thank the team that has been online, the interpreters for all the languages. Thank you very much. The panelists, I will not mention all the names, but we have over 15 backstage panelists that have answered questions. I want to support the team from ECHO India that have been very, very supportive to make sure that this goes smoothly. And we want to appreciate their support. Having said that, let me wish you a nice evening, and hopefully on 20th, we shall begin from where we ended and continue taking this agenda ahead to ensure that we all understand the new amendments, but most importantly, to ensure that we roll it out and implement this at the country level. Having said that, on behalf of the team, I want to bring this to a conclusion and talk to you soon. Bye for now. Over and out.
Thank you. Bye.
Bye.